Welcome everyone. We are here at ACC 22 in Washington, D.C. My name is Vikram Sharma. I'm a fellow in training at the University of Iowa Hospitals and Clinics. It's my absolute pleasure to introduce Dr. Bhatt, who's here with us today. He's, of course, the Executive Director of the Interventional Cardiovascular Programs at Brigham and Women's Health, as well as a Professor of Medicine at the Harvard Medical School. He has a wide range of research interests, include acute coronary syndromes, preventative cardiology, and cardiovascular interventions. He has played a pivotal role in several groundbreaking trials as a primary investigator, a co-PI, chair, and co-chair. These trials include the Charisma trial, the REDUCE-IT trial, Crescendo, Cogent, and Champion trials, just to name a few. Thank you so much for making time out of your busy schedule to talk to us today. We are here to talk about one of the trials by Dr. Bhatt and colleagues that was presented yesterday in the late-breaking clinical trials. This is titled Bentracimab immediately and significantly reverses the antplatelet effect of Ticagrelor in older patients. So as we know, Ticagrelor is a widely used P2Y12 inhibitor. It's used in patients with acute coronary syndromes, prior myocardial infarctions, and advanced CAD. Bleeding remains an important concern in patients that use this medication, and thanks to Dr. Bhatt and colleagues, they may soon be a commercially available reversal agent. I would like to listen more about your trial, if you can go through the key findings and what the trial was all about.
Yeah, absolutely. Well, thank you for asking. So, what I presented yesterday was a phase 2b trial of Bentracimab versus placebo. So, as you alluded to, Ticagrelor is a reversible antiplatelet agent. So, what that means is, with respect to the ADP-P2Y12 receptor, it's reversible. It doesn't mean it's immediately reversible. As we all know, it's in the system for about 3 days or so. And that reversible nature has allowed the development of a monoclonal antibody, a human monoclonal antibody, that can reverse the effect of Ticagrelor by binding to Ticagrelor and Ticagrelor active metabolites. So that monoclonal antibody is known as Bentracimab. And we'd studied it previously in a phase 1 trial. Phase 1 means healthy human volunteers, so some young healthy folks who volunteered. And that was really a dose-ranging study, and I actually published that in New England Journal of Medicine and presented as a late breaker at ACC in 2019. So that was the phase 1 trial. At AHA in 2021, I presented REVERSE-IT, which is an ongoing pivotal phase 3 trial designed for approval of Bentracimab. And what I presented was a pre-specified interim analysis of that, where we looked at patients who actually had indications for surgery and were on Ticagrelor and needed emergency surgery, or patients who were on Ticagrelor having major bleeding, things like intracranial hemorrhage. And in that interim analysis, we found that Bentracimab appeared to provide adequate hemostasis in the majority of patients, and that it was safe and didn't seem to cause anything like allergic reactions or thrombotic events or rebound or prothrombotic events, or that sort of thing. That study is not randomized. That's just patients come in, single-arm study. What I presented at ACC now in 2022 is a phase 2b trial of older individuals aged 50 to 80 who've been treated with aspirin and Ticagrelor for 48 hours and then were randomized to Bentracimab or placebo in a 3-to-1 ratio. That means 3 patients coming in with Bentracimab, 1 to placebo, so there are more Bentracimab-treated patients. And what we found in these older people, again, these are volunteers, but they're older. Presumably some of them have covert atherosclerosis and coronary artery disease and so forth, was, first of all, the drug was safe. There were no serious adverse events, no thrombotic events associated with the drug. There were no excess of treatment emergent adverse events, as they're called. The rates were similar between placebo and the drug. But in terms of efficacy, we looked at the Verify Now PRU test and the VASP PRI test, and we found essentially immediate and complete reversal of Ticagrelor with administration of this intravenous monoclonal antibody, Bentracimab. Furthermore, we looked at any signs of activation of platelets looking at P-selectin and mean platelet volume to see if giving Bentracimab and reversing Ticagrelor caused a rebound in platelet hyperreactivity or a hypercoagulable state, and we found no evidence of that. So as best we can tell from this around 200-person study is that Bentracimab is safe and it does what it's supposed to do. It reverses Ticagrelor's effect. As far as next steps, we have to wait for completion of the Reverse It trial, which, as I mentioned, is ongoing. It was interim analysis that I presented at AHA. We've got to enroll about another 50 or so bleeding patients, and then we will have satisfied what we told the FDA we would do. We would come to them with patients that needed emergency surgery. That cohort we've completely enrolled, and we'd come to them with some bleeding patients. That's the one that's partially enrolled.
Great, that's great. That's very exciting to the cardiology world, I think it can have huge implications for a wide number of patients who would have an indication for quick reversal of Ticagrelor. And of course, the next step, as you mentioned, is going to be completion of the Reverse It trial. When do you expect the trial to be completed and the results to be known?
Terrific question. The COVID pandemic did slow us down a bit. It's a bit hard, enrolling really sick patients when the pandemic is surging because you can't always even gain access into a hospital for the purposes of research. And if the hospital is overwhelmed with COVID, the last thing they're actually thinking about many times, understandably so, is research. But now that COVID is maybe winding down, I hope it's winding down. We'll see if it's winding down. We're hoping that enrollment will be brisk. I mean, just yesterday or the day before, we enrolled a couple of bleeding patients. So, we've got maybe 50 or more so bleeding patients to go. I anticipate that by the end of this calendar year, hopefully we'll be done with all the enrollment. So if we're lucky and things are on track, maybe this will be ready for presentation in ACC of next year. So if all goes really well, may be ready for presentation about a year from now. And then, we'll have to see what the FDA says to the data. We have spoken with them, of course, and the data we're collecting is the data, that we agreed we would provide to them. But of course, ultimately the decision to approve or not will be up to them. And if they do approve, in that case, this would be a new and I think potentially valuable option for patients on Ticagrelor that need emergency surgery, emergency invasive procedures of any sort, or that are having major bleeding, things like intracranial hemorrhage or a big GI bleed or a big GU bleed, that sort of thing. So I think for those patients, many times having a life-threatening bleeding complication or at risk of having a major complication from having surgery while on Ticagrelor, this could be a real game changer.
Absolutely, and I think we'll all await, those results being available for us to kind of verify the effects of this drug, which potentially can have a huge impact. You mentioned this one of the key findings from this study is the safety and efficacy of this medication. Did it identify any group of patients for whom this drug would be contraindicated for any reason?
To date, no. There's no contraindication that I could think of. I mean, there's always the allergy to the drug or what's in it. That's always in every label. But no, we haven't seen any allergic reactions, for example, or anaphylaxis or anything. And we know from other branches of medicine, including cardiology, I mean, human monoclonal antibodies are in common use, and they're actually quite well tolerated. So we haven't seen any of that. Now, of course, assuming it gets approved and is being used in real life, there are going to be patients that have thrombotic events, not because of the drug, but because they're on Ticagrelor. Probably they're on Ticagrelor for a good reason. They're probably at high ischemic risk. Now they're having a bleeding problem or undergoing a surgical procedure that Ticagrelor stopped. Well, they're not getting the protection that Ticagrelor is giving them. So, of course, in that context, there are going to be thrombotic events. But what we've carefully assessed to date and not seen any evidence of was that any of those thrombotic events are linked to either the Bentracimab infusion or its cessation. But of course, in any bleeding patient, one always needs to be vigilant for thrombotic events. I mean, we see this in practice all the time, right? Somebody gets a left main stent and then they have a big GI bleed, and somebody stops their clopidogrel and then they have stent thrombosis. The two often go hand in hand, and the reason I believe is largely teleological. That is, we've evolved in such a way that when we have bleeding events, the body is really saying clot, and that can be a problem if you have a fresh left main stent or you had a plaque rupture in the prox LAD last week. So the two often are occurring. That's why we were very careful to make sure that, at least to the extent one can study in the number of patients we have, that there wasn't any link. Or if there was a link, to find it and make sure that the potential prescribers of the drug were aware of it. But fortunately, we haven't seen that yet.
Those are great points, Dr. Bhatt. Thank you so much. So I think this trial forms an important step in kind of the systematic investigation of this drug, both in terms of safety, efficacy, and soon, hopefully, will show its clinical utility. Thank you so much for being with us here today and discussing the trial.